Hi, I'm Anthony Gosh, consultant spinal neurosurgeon and founder of the Spine MDT, and today I'm going to talk about common causes of arm or hand weakness and numbness. Firstly, we have to understand how messages get from the brain to the arm and the hand in order for us to be able to move it, and also how messages get back from the hand or the arm to the brain in terms of sensation and therefore numbness that you might experience. So the motor cortex, which is on the opposite side of the brain here at the right, nerves from that, neurons, send messages through the spinal cord, then out through nerves that come out of the cervical spine into this bundle here, the brachial plexus, and then they divide up into their different branches and innervate different muscles of the arm and the hand. And likewise, the skin as well sends messages along these nerve units all the way up through the spinal cord, again to the opposite side of the brain, into the sensory cortex. In any one of these areas can cause these symptoms, but let's try and work out how we can diagnose it. If the problem lies within the brain itself, like a tumor or a stroke on one side of the brain, usually that causes problems on the opposite side of the whole body. It's rarely isolated to just one part of the body, but it can be sometimes. But often in these patients, they'll have, as well as the numbness, they'll get weakness of the arm, but also the leg possibly on that side, and facial droopiness. These are signs of a stroke, and that's a medical emergency, especially if it happens acutely. Likewise, a tumor in the brain in the same region disrupting neurons can cause the same symptoms. Often that comes on slightly bit more gradually, and that is associated with a headache. Now let's move to the spinal cord. That's the neural tissue that runs down the spine inside the canal of the bony spine, transmitted messages between the body and the brain. So a cross section of your spine here. We can look at this image here. We can see that there, that yellow structure is the spinal cord itself. Anything compressing that, growing against it, or disrupting it inside it. So, for example, a disc compressing it or a tumor inside it, blood clot, can disrupt messages traveling up and down. Often, but not always, often when that happens, both sides of the body are affected. And again, you would expect it to also affect the legs. Now let's look at the nerve roots. So the nerves, just as they leave the spine, these branch off the spinal cord itself and form a nerve. So again, through this cross section, often they can get trapped by a slip disc or overgrowth or thickening of some of the bony tissue at the back from wear and tear, pinching the nerve. And often when that happens, it is usually on one side. It sends pain down the arm initially, but then that can be followed by numbness and even weakness of a different part of the arm, depending on which nerve it is leaving the spine. So, for example, the C5 nerve, the fifth nerve leaving the spine, innervates the shoulder abduction muscles, such as the deltoid, and you get weakness of shoulder abduction, being able to move your arm outwards. C6 is your biceps, so flexion of the elbow. C7 is the triceps, extension of the elbow is weak. And some of the hand muscles, and also different distributions will give numbness to different parts of the arm and the hand. So pain going down the arm with or without weakness and numbness is usually a trapped nerve in the arm itself, and that usually comes from slip discs in the spine or overgrowth or wear and tear of some of the bones and joints at the back of the spine compressing it. Once these nerve roots have left the spine, they then form the brachial plexus, this sort of bundle here. So any lesions within that can cause problems. Common things are trauma, though, in this case. So if your numbness and weakness of the arm and it's floppy hanging down by your side, just the arm only has come on after trauma, quite often with your neck rapidly being flexed this way. So certain injuries where you've been struck to the side of the head's flexed over this way and torn some of these structures, and simultaneously if your shoulders push down that way, that can happen. You often see that in motorcycle injuries. You can get lesions that damage these nerves that's here and tear them. Sometimes there are certain tumors as well that can affect these peripheral nerves as well, and cause that. Let's look at the peripheral nerves. So commonly the radial nerve, the ulnar nerve, and the median nerve. one condition known as Saturday night palsy, which the reason that's mentioned is when people have left their arm hanging over the back of the chair, and the armrest of the back of the chair digs into this for a long time, and you've just left it there. The nerve stops functioning for a bit, and injury, and that's the radial nerve. It can leave the wrist feeling floppy, so like a wrist drop. We call that with numbness somewhere at the back of the hand and back of the thumb area. That's usually the radial nerve. Usually it's lesions, it's things like that, injuries caused that way, which usually resolve, but sometimes it can be direct trauma as well, and rarely tumours. The ulnar nerve, the nerve that runs behind your funny bone here, when when you knock your elbow, you get that funny sensation. Often thickened tissues in this area over time cause entrapment of the nerve, and patients complain of numbness of the little finger and half of the ring finger. Often wakes you up at night, or if you're bending the elbow for a long period of time, you notice it, such as when you're reading a book in bed at night. So that's the ulnar nerve, and you can get weakness of some of the hand muscles from that as well if it gets quite severe, and wasting of the muscles. And then the median nerve, as it travels through the carpal tunnel, so carpal tunnel syndrome, where it travels through the carpal tunnel in the wrist, the tissues there getting thickened over time compress that nerve, and that tends to cause some pain and numbness of the thumb, index, middle, half of the ring finger, any sort of combination of that, with pain going up and down the forearm, and again that tends to be worse at night. Firstly, you can determine all of this from a good clinical examination. So an experienced clinician should be able to determine the cause from the history and the examination. And then we use tests to confirm these findings. So if we start off with the brain and spinal cord, peripheral nerves and brachial plexus, an MRI scan is probably the first investigation of choice to determine this. Exception of a stroke, the first investigation of choice is actually a CT scan here, because it's a lot quicker, gives you images quickly and rules out bleed in the brain so that the stroke can be treated as an emergency. Then for peripheral nerves, so radial nerve, ulnar nerve, median nerve, so carpal tunnel syndrome, nerve conduction studies are a very helpful test. This is where we have sort of electrodes on the hand and up and down the arm. Electric shocks are passed up and down, and we measure the voltages, and you can help determine and sometimes differentiate between 2 or 3 causes. In terms of how we manage this, you'll know from other videos I've done that I try and promote least invasive solutions that give you the longest lasting results, and I often try and find ways to avoid surgery. The exceptions often are, though, progressive weakness, because the role of any treatment is to try and preserve the function that you have and try and restore as much of it. So often in these scenarios where there is specifically weakness, not so much numbness, but weakness, and if it's progressing, that's when I do often advise surgery. And that is specifically, for example, around the spinal cord here. If there's compression of the spinal cord, that would be surgery to decompress it. So anterior cervical discectomy, I've done a whole video on that, or removing some of the back of the spine, or to decompress the nerve here, a posterior cervical foraminotomy. Again, there's another video link to that. With peripheral nerve compression, such as radial nerve, ulnar nerve, or carpal tunnel syndrome, the initial treatments are sort of lifestyle modifications, or positional modifications with various splints. Injections sometimes can help with the symptoms with a steroid around them, but with progressive weakness and quite severe compression, then there's surgical decompression, and these are fairly minor operations that can often be done with the patient awake, just under local anaesthetic, or even a regional block. I hope you found this video helpful. If you did, please give me a like and subscribe to the channel. It really helps people suffering with back pain, neck pain and spine disease find information that I try and post weekly to help. For more information, please visit us at spinemdt.com, where you can see our 3-step process and take our free online questionnaire. Our goal at the Spine MDT is to find the least invasive solution that gives you the longest lasting results, and we're able to do that by being the only organisation that has all the different practitioners of spine care, so a spine surgeon, osteopaths, chiropractors, physiotherapists, pain specialists, all working under the oversight of the surgeon to be able to deliver that goal.